The Jamaica Anti-Doping Commission presents JADCO and You. In the previous JADCO and You feature, we introduced you to the substances which are prohibited at all times on the World Anti-Doping Agency WADA's prohibited list. In this edition of JADCO and You, we will focus on the methods that are prohibited at all times and the substances that are prohibited during competition and in particular sporting disciplines. There are three classes of methods which are prohibited at all times: manipulation of blood and blood components, chemical and physical manipulation, and gene doping. Persons may not readily see the health effects associated with these methods, but when individuals seek to modify their biological makeup, it can be very dangerous.
What you have done by increasing the number of cells in the bloodstream is basically affect the liquidity of the blood and how it flows. This makes you prone to clots, and these clots can form in the veins and lead up to the heart, to the lungs, and you may have a pulmonary embolism, which is a clot in the lung that can lead to death. Withdrawing and reintroducing blood or taking blood from somebody else and introducing it into your bloodstream can lead to problems with infection. You can catch serious diseases such as HIV or hepatitis. Once you start to meddle with how the genes normally work, it may reach a point where you turn on genes and you can't turn them off, and you disrupt the entire genetic makeup of the cells, and this can lead to instability that results in cancer in the long term.
The substances prohibited in competition include stimulants such as adrenaline, cocaine, and pseudoephedrine, narcotics, for example morphine and oxycodone, cannabinoids like marijuana, and glucocorticoids including prednisolone. Because
stimulants stimulate your brain and your nervous system, if you take too much, you end up being anxious, jittery, you may have tremors, trembling, you may have palpitations in your heart, as well as high blood pressure. We generally use narcotics as pain medication because they're depressants. They can actually depress the centers in your brain that lead to breathing. So you may have breathing disturbances and actually respiratory arrest or a cessation of breathing completely. It may also affect your heart, and it affects your gastrointestinal system, and it may lead to constipation. Cannabinoids are found in cannabis or ganja. If you're taking a lot of cannabinoids, smoking a lot of marijuana, etc., then what happens is that it affects your mood. It may lead to depression. It may lead to loss of interest in regular activities and lack of motivation and drive. And if you're smoking, then you can have some effects of smoking on the lungs.
As it regards substances considered as glucocorticoids, there are some special conditions associated with their use.
Glucocorticoids can be used to treat joint inflammation and injuries involving your tendons, can be used to treat asthma and certain skin conditions. And as such, those indications would be covered by a therapeutic use exemption.
Athletes engaged in particular sporting disciplines are also prohibited from using two classes of substances in competition. In aeronautics, archery, and motorsports, for example, the use of alcohol is prohibited.
It dulls your reflexes, it makes you drowsy, and your reaction time is less. If you are doing aeronautics or driving in particular, these effects would be very dangerous for not only you, but the other participants and the fans.
The final class of substances on the prohibited list is beta blockers, and they are prohibited for athletes participating in archery, underwater sports, golf, and others.
As beta blockers affect your cardiovascular system, it may decrease your heart rate to a point where not enough blood is being pumped out, and your blood pressure as well would fall, and you may end up with a heart attack or a stroke, or you may, in lesser instances, end up in a coma.
For more information on the health consequences of doping, contact JADCO's offices at 5 to 9 South Odeon Avenue, Kingston 10, telephone at 929-3500, or log on to www.jadco.gov.jm. You may also find JADCO on Facebook, Instagram, YouTube, or Twitter. JADCO and You was brought to you by the Jamaica Anti-Doping Commission.